Hi, Bio 245. This is Vanessa again, and we're going to go over muscles of the lower limb. And again, I got my little handy-dandy list, so I'm going to be trying to stay in the same order as provided. So, first off, just to orient you to where we kind of are, always keep in mind that whether you're medial or lateral, so always look for your big toe right here versus your pinky toe, so big toe is always medial, right? Also, for your hip stuff, on this particular model, you'll see that you can see actually the head of the femur poking out, so that's going to poke out medially, okay? Because as you guys know, it's going to facet into the pelvis, which sits about here, so yeah. Let's start laterally on the outer hip, and we're going to go from the upper leg down to the lower leg. So first off on your list is the tensor fascia latae. So you can pronounce the latae part how you want, but that's what makes sense to me is that latae because it's L-A-T-A-E. But for the tensor fascia latae, again, it's kind of on the hip here. But here is the muscle part of it, so the belly of it, like we were talking about for the occipital frontalis, for the frontal belly. But anyway, so here's the belly of that tensor fascia latae, and then it extends down as just kind of this white stuff here down the side of the leg. And whenever you look at the position of the muscle, you kind of know what it's going to do. So if we know that this guy is on the hip, when it shortens, it's going to swing that femur out. So it's going to abduct your leg at the hip. So abduct your leg at the hip. So again, if that muscle shortens, it's going to probably swing your femur out. Okay? That's what it does, in fact. All right, so moving in medially, we're going to stay kind of up top on your leg here. So you can see that there's this lower stuff. So we're going to do the top stuff first, and then we're going to come back around. Okay? So we went from our tensor fascia latae, which is on the hip, and we're moving in more medially to our iliopsoas. Iliopsoas. So on your leg model, the iliopsoas is kind of underneath this long muscle, which you know we'll talk about a little bit later. But as you can see, I took that muscle off to reveal most of it. You'll also see that for that iliopsoas, this right next to it are these big veins and arteries and this big nerve. Okay, so anyway. So here's your iliopsoas. It actually goes deep inside of the body and attaches on the inside of the ilium. What it does is it's a powerful flexor of the hip. Okay, so when I say flexor of the hip, what that looks like, if you can see me, okay, you can kind of see me. So flexor of the hip is going to be like one of these. Okay, well, so ignore the knee. You're only paying attention to the hip. So a flexor of the hip is going to do one of these. Okay. All right, next is your sartorius. So that's that muscle I actually just took off. So I'm going to put that back on just over the top of the iliopsoas. You can see that the sartorius is this long, skinny dude here. Okay, this is actually the longest muscle of the body, I believe, and it does a few different functions. But as long as you remember at least one, you'll be in the green. So this does some flexion of the hip, also some flexion of the knee. It also helps with abduction at the hip, so, you know, swinging it outwards, right? Swinging it out, so from your midline, right? There you go, abduction. It also does lateral rotation, so here's your pinky toe and your big toe, so lateral rotation is going to do one of these. Okay, there you go. Okay, so there's your sartorius and all the different things that it does. Moving on, we have the adductor magnus. So both of the adductors we're going to talk about. So the adductor magnus and the adductor longus. Again, I just took off the sartorius to reveal it. They're both medial. Makes sense, right? Because if you have an adductor, it should be more medial on the leg to swing that femur inwards, right? So for your adductors, here's your iliopsoas, right? Going next to it, here are your adductors. So here's your adductor longus, right here on the other side of those big veins and arteries from your iliopsoas. And if you turn your leg around a little bit, the adductor magnus starts back here, and there's this like long straight muscle here. So it starts back here, it tucks underneath this long straight muscle that we're going to talk about in a little bit, and it pops back out underneath here. So there's that adductor longus, and here's the magnus, which goes from here all the way back to here. Okay? So there you go. There's your adductor longus and your adductor magnus. Functions in the name. They adduct the leg at the hip. Next, we have our gracilis. The gracilis is that long straight muscle that's in the way of our adductor magnus. So here you go. It's this nice long sheet of muscle on the inside of the thigh. So again, just to orient you, there's your big toe. So there's your gracilis on the inside of the thigh. So it's an adductor as well, along with the other adductors. Okay, so moving to the front of the leg, moving down just a little bit, we have the quads. Most people know these as the quads. There are indeed 4 of them. That's why they're called the quads, or the quadriceps you've probably also heard. So first off, in the dead center of our quads, this right here is going to be your rectus femoris. And a lot of people get this confused with the biceps femoris, which we're going to talk about in a little bit. But just know that for our rectus femoris in the leg, really the rectus femoris is the only one that kind of has this stripe down the center. See that? There you go. So the rectus femoris, all the quadriceps are going to do extension at the knee. So extension of the knee, okay? Like kicking, okay? So there's your rectus femoris. Now the other guys are the vastices, and the vastices are just named whether or not they're medial or lateral. So here's your big toe, so that's how we know we're medial. So on the medial side here we have our vastus medialis. On the lateral side we have our vastus lateralis. If you take off your rectus femoris, you have your vastus intermedius, okay? Right underneath where the rectus femoris would be. So again, these are all making up the quadriceps, so they do extension at the knee. Okay? Moving on to the back of the leg. There you go. And just to keep you oriented, here's your big toe, here's your pinky toe. So this is going to be medial, this is going to be lateral. Okay? So first on your list is the gluteus maximus. So gluteus maximus is your butt muscle. Okay? Super powerful muscle on the body. And it's going to help with extension at the hip. So if you think about working out at the gym and you want to work out a muscle, you're going to work it out in that you're going to repeat its normal activity. So the gluteus maximus extends at the hip. So there's this like machine at the gym that you can do where you tuck your ankle onto this like rolly thing and you just move your leg back like that. So you extend at the hip over and over again, and that's how you work out that muscle, because you make it do its action over and over again with increasing weight or decreasing weight, however or whatever you would like to do. But that's your gluteus maximus, your butt. If you take off your butt, just deep to it, you will find your gluteus medius. So here is your gluteus medius, just deep to the gluteus maximus, and you can still see actually your femur sticking out over there as well. Okay, so just keep that in mind. And the job of the gluteus medius is it's going to help with abduction at the hip. Okay, and it kind of makes sense just based on the fact that this muscle comes up and it's holding onto the head of the femur, so it's going to help swing the head of the femur, or the whole femur, up and out. Okay, so that's the gluteus medius. Moving on, so sticking with the back of the leg, and now we already know that this is our medial, this is our lateral, okay? So going to the back of the leg, we're going to talk about the hamstrings, okay? The hamstrings. First off, on your list, you have the biceps femoris. The biceps femoris is going to be on the lateral side here, on the lateral side. So the hamstrings, these are your hamstrings right here. They do flexion at the knee. And the lateral side of your hamstrings is going to be the biceps femoris, right here, okay, on the lateral side. On the medial side, you actually have 2 muscles stacked together. So if you look close, there's one on, oops, it's hard to look at this backwards, but there's one on the top, and then there's one deep to it. The one on the top is the semitendinosus. The one underneath is the semimembranosus. So I always remember semitendinosus is on the top, T for the top, and that the semimembranosus is underneath. And I also remember for medial versus lateral, because some people are like, oh, I can't remember if biceps femoris is lateral or medial. I go, oh, well, semimembranosus has an M, so it's more medial. So that's what I do to remember. That helps me. So here's your semimembranosus. Semitendinosus is on top. Okay? Okay, moving on down the list. So we're going to the lower leg now. So let's move this down so you can see. So first off, we have the tibialis anterior. Now when you look at the leg with all of its musculature attached, you can actually see the tibia sticking out right here, so your shin bone, right? So right next to your tibia, on the more anterior portion, based on the name, we have our tibialis anterior. For the function of our tibialis anterior, it does help with something called dorsiflexion. So just a quick note here, for your foot, the dorsal portion of your foot is the top of your foot. So if you raise your toes up like that, that's called dorsiflexion. The bottom of your foot is the plantar portion of your foot. So if you do plantar flexion, that's pointing your toes down. So like standing on your toes, that's plantar flexion. So the tibialis anterior helps with dorsiflexion, so raising the toes. That makes sense, right? Because if this muscle shortens, you can see it kind of goes down into the foot, so it's going to pull it up like that. Okay. Next, we have the fibularis longus. So this kind of makes sense. If we have our tibialis anterior along the tibia, your fibularis longus is going to be along the fibula, and we all know that the fibula is more lateral. You can even see the fibula poking out a little bit right here. So there is the fibularis longus and the fibularis brevis. So the fibularis longus is the upper portion, the fibularis brevis is the lower portion. And they're both going to help with something called eversion of the foot. So eversion of the foot is just basically taking here's your pinky toe, it would be kind of raising your foot out, like that. So raising your pinky toe up and out. So that's eversion. And both your fibularis longus and fibularis brevis do this. The fibularis brevis is this lower portion right here, like I said, and the longus is this upper portion. So if I put a sticker up here, it's the longus. If I put a sticker down here, it's the brevis. Moving on in your list. Actually, I'm going to skip around on your list just a little bit. Can stick with the front here. So we went over our tibialis anterior, and we went over our fibularis longus and our fibularis brevis. This, in the middle of them, is your extensor digitorum longus. Extensor digitorum longus. And whenever you try to remember the digitorum part, I mean, you can actually see that it crosses the ankle here and it goes into each of your toes. Okay, so that's going to be your extensor digitorum longus. The reason why the front stuff is extensors is because if you think about it, and if you extend your toes, you're like raising them out, versus if you flex your toes, you're curling them. So the ones on the front of your leg are going to be extensors, they extend your toes, and the stuff on the back of your leg tends to be flexors, they flex your toes. So anyway, extensor digitorum longus. Moving on to the back of the leg, there's two more muscles. First off, we have the gastrocnemius, and you'll notice that on your list it's spelled gastrocnemius. This is not a spelling error. It's just people tend to pronounce it gastrocnemius, but pronounce it however you need to remember how to spell it. That's what I always say. So this whole thing back here, your calf muscle, as you guys might know it more, is your gastrocnemius. And that's going to help with plantar flexion, so standing on your toes, right? If you want to work out your gastrocnemius, you stand on your toes with weights in your hands. Excuse me. One more muscle left. If you peel off a piece of your gastrocnemius, I'm dying. Just deep to it is your soleus. Excuse me, I'm sorry. So if you peel off your gastrocnemius, you reveal the soleus. The soleus is also aiding in plantar flexion. So here it is right here. So we've covered all the muscles of the leg. And that's it for muscles of your body and their functions.
Where's the other bits?